at 3 o'clock, right back here, we're going to discuss why. So what does your provider do with this information, and why are we so dang nosy? So the big components of an annual wellness visit, the first one is a health risk assessment. We do a psychosocial assessment, an advanced directive assessment, a preventative testing review, and a vital sign assessment. Your provider may also choose to complete a physical exam or order any lab work either before or during your appointment. So let's dive right in. The health risk assessment is the first component of the visit. Sometimes this is a written survey. We at UNC choose to ask you the questions because I feel like we get a better response, because sometimes your answer leads to a little bit more than a written piece of paper would. There's a lot of questions, and some of them get downright personal. They start with easy questions about your general health, your dental health. These are generally something like, how do you feel about your overall health? Poor, fair, good, very good, or excellent. This will be repeated for your dental health as well. You may also be asked about having serious difficulty hearing, and if you'd like to be referred to a dietitian if your body mass index is either too high or too low. Sometimes we don't ask you if you have serious difficulty hearing because we know, based on our conversation. We can tell. The next set of questions pertains to the safety of your home. Most of these questions are easily answered because you live here at Glen Eyre. This ensures that your fire alarms are working, your carbon monoxide detectors are there and working. Other questions in this section include things about throw rugs, non-slip mats in your shower or tub, those kind of things. Answer that honestly. It's not a punitive. Even if you have a throw rug that's not hooked down, you're not going to get, negative points. We just then will have a conversation about why you probably should have that secured down. Next, we talk about your driving safety. We'll ask if you wear a seatbelt when you're in the car, if you're still driving, if you're not driving, what your mode of transportation is, like family, friends, public transport, Glen Eyre Transport. Additionally, during this question section, we'll ask you about your activity level. So this includes how often you participate in strenuous or moderate activity. This includes things like walking fast, running, dancing, swimming, biking. We don't expect a lot of people to be running, just so you know. The final set of questions in this section will ask you about your smoking status. Have you used tobacco products in the past? Have you ever used e-cigarettes or vaping devices? That's the newest question series. We'll also discuss, usually at that time, alcohol use and sexual activity, whether you're still sexually active, number of partners, etc. There is a rhyme to our reason. We're not just nosy, I promise. So let's see. And some of you are seeing right now, well, I've had this, but I've never been asked those questions before. You're probably right, because a lot of times when you fill out the admission paperwork, the 17 pages that we all send you, you have to check those boxes in there. And so they just ask if you've had any changes in your life in the last year. So you may not have been out and out asked some of those questions, but at some point you did check a box to answer that question. Next up is our psychosocial assessment. So this is one that I feel is particularly important, especially as you age. There's still a fairly large stigma around mental health and mental issues as being not real diseases, and they are. They're just as dangerous for you as your hypertension and your high cholesterol, and they're just as much driven by your body chemistry as your hypertension and your cholesterol. So the first portion of that is a depression screening. This is where we discuss with you things such as your mood and your overall sense of quality of life. So this can be a very uncomfortable section for people because we do out and out ask you things like, have you thought about killing yourself? Do you wish you were dead? Do you feel like you're not meeting your family's needs? Things of that nature. It's okay if you felt any of those. This is an information gathering tool to help you live the best life that you can and help you feel as healthy as possible on all aspects of your life. And honestly, even if you answer some of the questions with yes, that doesn't mean you have depression either. You know, we're all tired. We all have some weeks where we're more tired than others. That's one of the questions. So if you say, yeah, I was tired every day in the past 2 weeks, that's not inherently going to be, oh, they're depressed. You know, that just triggers a longer conversation about, you know, why have you been tired? Were you in 50 activities in the past 2 weeks? You know, did you run a marathon? You know, have a surgery? Those kind of things. So we also do a cognitive status assessment. That's going to be another big piece of that psychosocial assessment. We do the slums here at the clinic, which is a fairly long test. You all probably, some of you who are just coming to the expansion or have just moved in are very familiar with that because you just had to do it or will be soon if you haven't. You get one done when you move into Glen Eyre. There's a math question. We ask you to draw a clock. We tell you a story about Jill. And so what we use that information for is just to kind of monitor and say, hey, there might be some cognitive delays coming. You know, we've seen that your scores decreased or, you know, hey, your score's staying strong. So that's another piece of information. And I know it's a test, and so that's a 4-letter word, and everybody gets really anxious about it. But that's not something that I go to Suzette with and say, oh, my God, this person has to move. Their slum score dropped 2 points. You know, because I know that's always a big concern as well when we do some of these tests. That is not what happens. We use that as a part of your clinical information. A lot of people that are not with UNC Health at Glen Eyre do a very simple test where they ask you to remember 3 words and draw a clock. That's fine too. We just choose to do a more thorough one because we know we have a very high-risk population for cognitive concerns. We also sometimes do something called GAD-7 or geriatric anxiety. I just completely blanked on what the D stands for. Maybe it's catching. General anxiety disorder screening is what that's. So it's 7 questions, including have you felt nervous or anxious in the past 2 weeks? Have you noticed that you're becoming irritable easily? Again, just answer those honestly. We just need to know that information to help figure out how to help you the best. The next section covers your functional ability. So this usually begins with a falls risk screening. It's usually 2 questions. Have you fallen in the past year? And do you feel unsteady when you stand or walk? I'm going to take a little break to do my fall spiel. A fall is any time that you have a sudden change in elevation. That includes slips, trips, falls. I sat down really hard. I leaned against the wall and slid down. Those things all count as a fall. And again, that's something that we as providers need to know about because as you age, your risk of falling with an injury becomes much, much higher. And so there are very easy things that we can do. Sometimes it's just a medication you're on that's causing you to have some dizziness and fall. So we just need to know that information so we can help you live, again, your best life. So the other thing that frequently we do to assess for falls risk at a annual wellness visit is called the TUG, or timed get up and go, or sometimes just timed up and go. So if you've done a wellness visit with us, you're familiar with my pieces of tape on the floor. You stand from a chair, walk a certain distance, turn around, and sit back, walk back and sit. We time you. Anything under 13 seconds is normal. Anything under 20 seconds is considered a low risk of falls. So that just is another marker that we can use to say, hey, this person might need a little extra TLC in the falls department. We also are very aware that some people have chronically slower gaits for various reasons. So again, it's just a tool that we use. It's not necessarily, a hard and fast, oh, you got a 25 on a tug, you're a falls risk. We understand that that's just one test. The final series of questions in this section relates to your ability to take care of yourself or do what we call your activities of daily living. Those are things like bathing, dressing, eating. Can you manage your finances, your medications, etc.? Especially if you're in independent living, which I think everyone in here is, those questions are super important for us to know because that may indicate that we need to get you in some therapy to help with that. If you're having trouble managing your finances, that's a huge thing. We want to be able to help you as best as we can. The next section is advanced directives. So that's where we discuss your current advanced directives, things like medical power of attorney, DNR, or do not resuscitate orders, and most forms. Living wills also fall under this category. So when you move into Glen Eyre, generally they get a copy of that. I'm able to, because of my access to both systems, I can pull your records from your Glen Eyre chart and upload them into your UNC chart. So we try and keep those accurate. But if you have had updates or anything since you sent it there, or if you're in an outside provider group, it's important to bring that with you so that they can have a copy of it in their records. This pretty pink form over in my picture is called a MOST form, or a medical orders for scope of treatment. So that form in particular tells EMS and hospitals what you want done if you can't speak in your own terms. So if you're a current resident here at Glen Eyre, if you have one of these, it should be in your fridge with your current medication list and they call it a face sheet that Suzette's working through those. So you may have one, multiple, all of these. That's fantastic. If you don't and you want one, especially a MOST form, that's something you can talk to your healthcare provider about during any visit, and they can help you fill that out appropriately. That form needs to be brought back every year to your annual visit so that your provider can re-sign it, confirming that you've discussed those points and those are still accurate. If you fill one out 5 years later, your ideas change, you just say, hey, I need to fill out a new one. I've changed my mind. I want to update it. That's not a big deal at all. If you are not comfortable filling it out in the office, you can take it home and come back and fill it out another day. The next thing we do is a preventative testing review. So this ensures that you're up to date on all the health things that help prevent chronic diseases or prevent cancers, etc. This includes things like mammograms, colonoscopies, and bone density screenings. It can also include things like lipid screenings, blood counts, thyroid function, or diabetes screening. Your provider will look through your history and determine what, if any of those, is necessary. Just an additional note, many of these screenings are recommended to end between the years of 75 and 80. So pap smears are not being recommended after 65 either. So providers take that into consideration, but if you're at your doctor and they don't mention the mammogram this year and you're over 75, you can always ask about that. There are exceptions to every rule, of course. If you have a personal or family history of things, then we continue some of these preventative screenings a lot longer. So just make sure if they don't mention it and you think you're due for something, you ask them about it, okay? At the end of your visit, you get a printed summary of all of your health maintenance items and what's up to date and what's due. That's required by Medicare, so if you don't get one, ask for it. Your provider will also look through your immunizations and make sure that you're up to date on all the recommended ones for your age category. The final component of an annual wellness visit is vital signs. Medicare requires that those are taken if you have an inpatient or an in-person visit. The in-person will make more sense in a minute. A BMI will be calculated, and a waist circumference may also be taken as part of these vital signs. Most of this is completed by a nurse or medical assistant when you first get into your appointment, and the provider then reviews them and determines if anything needs to be changed in your current medications, etc. During your visit, your provider may choose to do a physical exam, or they may choose to complete this at a separate visit. If your visit is completed by a social worker, an exam will not be included. And your provider may also order additional lab work based on what the discussion is during your visit and if anything comes up. So some helpful notes about annual wellness visits. They can be completed by a number of different types of healthcare providers. So it may be completed by a provider, such as a nurse practitioner, a physician assistant, or an MD. It may be completed by a social worker, also sometimes known as a case manager. And it can also be completed by a nurse. Sometimes if they're done by a nurse or a case manager, they do so virtually. So they'll call you and run through the questions. And that's completely appropriate and acceptable per Medicare guidelines. This visit is 100% covered under your Medicare Part D plan, or B as in boy plan. You can have it done yearly, but you cannot have it done before the date of your last one. So if you had it October 15th, you cannot have it any sooner than October 16th of the next year, or Medicare will not pay for it. And you will get slapped with a nice, lovely bill, which is no fun. So always make sure it's one day after your last one. Most of the time when you have these visits, you cannot talk to your provider about anything else other than the Medicare annual wellness visit. This is especially true if it's not completed by a nurse practitioner, physician assistant, or doctor. The case managers and nurses cannot handle any other problems while you're there. There is a chance there's some interesting Medicare things that happen. When I do an annual wellness visit, can talk to you about other things. I will just notify you at the time that you will also be billed for an office visit. So it won't be billed under your wellness visit. So you'll see two separate charges on the same day. It gets confusing and down through the weeds. Medicare will cover both of them in the same day, but it just looks funny on your bill. You can also, for these, you should bring a medication list or your pill bottles and a list of any other providers that you see. That would include specialists like cardiologists, nephrologists, anything with an ologist at the end of it, we want to know about, okay? That's the specialty groups in particular, because that just allows us as providers to know, hey, I noticed this person's got a heart thing going on. Let me reach out to their heart doctor. And so that just gives us a good picture of who we can help you the best with. All right, so this is not one of my longer presentations. On April 4th, come back at 3 p.m. to hear exactly why we do all of this and why we're so darn nosy. Are there any questions about what we went over today? I know it's kind of a lot of information packed into a short time period, and not a lot of details, so there may not be. But if you have any burning questions, now's the time. So his question was, how do you know how much information we now have? So for UNC in particular, if you have been seen by any UNC provider, we have the basic information, your insurance card, demographics, etc. And our records connect with WakeMed and Duke. So a lot of times we have a good amount of information. If you've been in the Duke system for 20 years, etc., your medications and things like that will pull over into our charting system. There's not a good answer to exactly how much information we have on every person because it's very particular. But if you see an outside provider, like I know Dr. Womble, CAPS, and Outlaw are pretty common. in this environment, unless we have specifically requested their records, we do not have that information about your like annual visits and your appointments with them in our system. That's a good question. Next, thank you.
I wanted to ask about that MOST agreement.
Mm-hmm.
I know I signed one about 10 years ago when I had my knee operated
Mm-hmm.
on. I have a copy of it, but I don't know if it's still in effect. It implies that it is, and I hope it isn't.
So technically speaking, they're supposed to only be good for 1 year, which is why we re-sign them. I would definitely do a new one, though. Talk to your healthcare provider about doing a new one, and that way you have it as accurate as possible. If it's not accurate, pull it out of your fridge. If it's in your packet and you don't want them to do what it says, take it out. It's better to not have anything in there than have information that's not what you want, if that makes sense. You're welcome. Any others? Hold on just a second. He's going to get you a microphone.
How long do these tests usually take?
Like the labs and things? Oh, the whole thing. So it very much depends. So we're very blessed as a geriatric practice. I get an hour to do these visits. Some people take a full hour. Some people take 20 minutes. Some people take anywhere in between. A traditional primary care, I think, is 40 minutes for a yearly visit, but not all of them even have quite that long. I would say on average, the depression screening usually takes anywhere from 5 to 8 minutes. It's pretty brief. A mini mental takes about 3 minutes if they do the short cognitive test. A slums is usually about 10 to 15 minutes on that one just because there's so many questions. So, I mean, reasonably 20 to 30 minutes. An annual wellness can be done in 20 to 30 minutes depending on who the person is, but some take quite a bit longer than that as well. Anybody else? Oh, hold on just seconds. Emery's getting his exercise today. Please don't fall.
Could you explain the changes here at the healthcare center? You're here fewer days during the week, right? And could you explain?
Yeah, sure. So I am technically still here 5 days a week. I just spend Monday morning in the healthcare center rounding with Dr. Ahmed, so I'm up to date with all the patients. And then Thursday afternoons, I spend in the healthcare center caring for those patients as well. So Dr. Ahmed, our medical director, is here on Mondays and Tuesdays. He is primarily focusing his efforts at the moment in the skilled nursing center to ensure we get the highest quality of care we can for those patients during this transition. And as that gets settled, he'll start taking patients in the clinic on Tuesday afternoons, I believe. So now he's doing a little bit of, he's seen a few people on Tuesday afternoons already. So if you have a preference to see a MD versus the NP, you can always just let Jesse know. When you call, he does have some limited clinical hours right now for the clinic time. But we are still, and for emergencies, if there's an emergency with an independent living patient that I need to be involved in, even if I'm in skilled nursing, I can be called out of there by my secretary. So Jesse, the main number to our clinic is your go-to if you have pressed your button, you're having a semi-emergency, but you don't need to go to the hospital, but you need to be seen. Jesse can pull me from where I am if I'm needed. So I am still available to you all during all the hours that I'm here. We just have sort of tried to not book appointments during that time so that I can focus some efforts on them as well. I hope that answers your question a little bit. Anybody else? All right. Well, don't forget, I've been told to plug the Asian dinner tonight. It looks fantastic. I can't wait to hear rave reviews on Monday when I come back about how wonderful it was. And I believe there's also a spring fling event in here tonight that sounds like it's going to be a good time. So if you have any more personal questions you'd like to ask me, I'll hang out for a little while. And if not, I will hope to see you all back on April 4th at 3 p.m. to figure out the why of all of an annual wellness visit and what that we use that information for. Thank you.